to acquire this piece of property, to save it because it's a really nice piece with a lot of high quality wetlands on it. Public outreach, we'll do a lot of stream cleanups and stuff like that to get the community engaged, to get out there, look how excited they are to be there. They pull stuff out, they do a good job. At the end of the day, they feel good about themselves. I threw this in here because, again, this represents where we're at right now, I think, in terms of a balance. We have not been upholding environmental integrity, and the weight has been on what we're doing to I guess, push ourselves as a race, to push ourselves in terms of, like, what are we doing to make the extra dollar with giving little consideration to what the environment is. So right now, things are much, much out of balance. It used to be this way, and that was in the heyday of everything. It's this way now. This is where we're headed, right? And so what does that mean? It means that we have a necessary shift that we have to make. Clean water makes a healthy community. We have to make these changes from consumption to conservation. An ideological change, get out of your car, keep it in the neighborhood. The zoning and local ordinance adoption on planning is really where it's at right now. There's so many things that we could do at that local level that govern what goes on in those communities. We're not doing enough, I think, in that arena right now to really make a significant difference. Obviously, we need to stop treating water as a waste product, and we need to start treating it as a resource, because that's exactly what it is. Making the connection between sustainability and watershed management, something that we're really focusing on at the Board of Health. Our program right now is providing a holistic approach, meaning healing from the inside out. Before that end of the pipe going back in the stream, what are we doing up here on the inside, if you will, to make sure that that water is treated or stays there or goes back into the ground or back into the atmosphere before it picks up all those impurities going back into the water, healing from the inside out. As a watershed coordinator, we can only do so much, so we might do a lot of work, but we still may not get that result in attainment, because one community upstream may not do something, the community downstream does something, it kind of negates each other as things flow downstream. The cumulative impact of these behavior changes that I've been talking about through education and outreach will certainly be crucial to the ecological recovery of the watersheds. What is our 5-year plan? Basically to create different programs at work in order to create a comprehensive approach to healing these waters, but also just to public health in general. So what are some of these new sustainable environment unit programs at the Board of Health? Well, we'll have a stormwater program, which we already have now. We already have the sewage program. We do beaches, water quality, educational outreach more, watershed planning like we're talking about now, major restoration projects, some things that I'm working on right now. Fats, oils, and greases, pharmaceuticals in the water, take-back programs, having people come in and drop off their unused meds so we can keep them out of the water supply. Climate change stuff, urban agriculture stuff, marketing what we do, solid waste, promoting recycling and composting, built environment stuff. So a couple of examples. We right now have an ATSDR grant and looking at applying health impact assessments to brownfields, what we can do to redevelop them. So we're looking at land use initiatives as well. Watershed management stuff, right? As I alluded to, we're doing a restoration project on Mill Creek. We have some wetland studies, what we're doing. We're doing 3 other restoration projects that are in the works right now. Potential projects that we're going to look at. Porter Creek is a creek that flows right next to a beach, a Huntington Beach. There's sometimes high bacterial levels there during the swimming months. What are we going to do those stormwater retrofits to remove that out of the water? Other restoration programs, getting involved in some sustainable things in Cleveland. I just threw this in here, but again, we don't have to talk about this because it's been clearly gone over quite well by the doctors. The last picture I have here is simply just kind of gives an overview of Lake Erie. If nothing else, this kind of indicates everything that I've been talking about. If this is part of the 20% of all the fresh water on Earth, if you look over to, and you can't see it unfortunately, but the western basin of Lake Erie is heavily sedimented, a lot of nutrients, a lot of hypoxia areas, the littoral zone, the coastal areas, devoid of oxygen, or a lot of, not necessarily devoid of oxygen, but a lot of algae increases because of all the nutrients going in and so forth. These are the things we got to protect. These are the things that are going to ultimately help us sustain our environment for future generations. We don't inherit the land from our ancestors, we do borrow it from our children. Always remember that. And again, thanks for the time. I'm sorry I went too long, so I appreciate it.